One of the questions we typically get asked here in the clinic is movement or rest better when I'm in pain? Almost always the answer is going to be movement. I know it's counterintuitive, so why? Well, if you're sedentary and you decide to rest, you're going to get stiff. You're not going to promote blood flow, which is carrying oxygen, which your body needs to heal injured tissues. Oxygen delivery is paramount for injury recovery. You're also not going to open up your neural pathways to help retrain your nervous system via endorphins and neural pathways so that you can perceive less pain over time with increases in movement. Rest also promotes muscle atrophy and can contribute to joint stiffness, all of which are counter to pain reduction in the long term. So, the reason that you come to a place like this and see your physical therapist is to appropriately dose your movement patterns, your strength training, and appropriately guide you through motion that will, over time, reduce your pain response. Thank you for listening.